Good afternoon and welcome to this COVID-19 briefing. I am Robin Kaler, Associate Chancellor for Public Affairs. Today we have an update on the fall 2020 semester with some very helpful information about now and about going forward. Our panelists today are Chancellor Robert Jones, Vice Chancellor for Academic Affairs and Provost Andreas Kangalaris, Professor of Chemistry Marty Burke, Professor of Physics Nigel Goldenfeld, Professor of Epidemiology Becky Smith, and Champaign-Urbana Public Health District epidemiologist Awais Vade. Thank you to all of our panelists for joining us today. For those of you watching, if you've followed our briefing series, this one will be a little bit different. We won't have any presentations today. Chancellor Jones will offer some opening remarks, and then we'll dive right into the many questions that members of the campus community have asked over the past few weeks. So Chancellor, could you unmute your mic now and get us started?
Yes, Robin, I think I'm unmuted. But let me start by saying thank you, Robin, for moderating this event, and thanks to each and every one of our colleagues who are joining us today for this November COVID-19 briefing. I think you all are very much aware that we held 10 of these sessions throughout the summer and into the beginning of this semester. So in many ways, this is like bringing the band back together again as we are headed into these final weeks of this semester of in-person instruction. And as we are seeing COVID-19 cases in the community, in our region and across the state and across the nation rise, we felt very strongly that it was important to bring us back together again to offer an update on our campus and the community. And we really are entering a very critical period. And we wanted to provide our students, our staff, and our faculty with as much information as possible about our COVID-19 plans, our progress, and I might add the challenges and the opportunities that lie ahead. We have a long list of questions that we feel really compelled and excited about addressing here. Questions that have come from the university and the surrounding community. So with that, I am going to turn it back to Robin so we can get started and hopefully navigate our way through all of the very great questions that you posed. Thank you again for being with us.
Thank you, Robert. And I actually have the first question for you, but before I do, I realized I forgot to introduce Vice Chancellor for Student Affairs, Danita Brown-Young, who's also with us today, and we'll have a lot of good information. So Danita, thank you. I'm so sorry. So Robert, again, I'm going to start with you. The question that we have gotten many, many times, and I know you've answered it many, many times, is wouldn't it have been just safer if everybody in the fall semester just stayed home and the whole thing was entirely online?
Well, Robin, I agree. This is probably at the top of the most frequently asked questions. And I think the basis for this question is the assumption that individuals would be safer if they had stayed in their own communities rather than coming back to campus. But I think it's very, very clear that that is probably not the case. We don't believe that to be the case. We have one of the best and the most rigorous testing programs anywhere in the nation, and that is very, very clear. And we have in real time been able to pivot and to quickly address the increases that have occurred, the spike that occurred back in August. And we've been able to mitigate that because of our testing protocol. And we know for a fact that there is no evidence of spread in the classroom. And we require people to be able to show a access granted pass to get in the classroom. We believe that our classroom environment is one of the safest places, not only at this university, but in the state and in this nation. And people are telling us that the Safer Illinois app really is helping them feel better connected with the community. They're using this app to make decisions about their own behavior. And so I would say to you that we think the decision to bring people back was the right decision, and that everyone in this community is safer because of all the actions that we've taken.
Great, thank you. So it sounds like you would say our approach for fall 2020 worked. If so, what would you say went well?
You know, I think there are a number of things that went well. but I'm going to ask the chief architect of a lot of what you've seen rolled out here, our provost Andreas Cangelaris, to kind of give his perspective on what has gone well, what the lessons have been learned during this critical period, and the things that we will be doing in the future to keep this university and the community safe. Andreas?
Thank you, Chancellor Jones. Well, let me start by saying what went well is that we do two things right, I believe. We realized that we have to approach this plan of bringing back the campus together in the fall as a community. And the second thing is, and we were able to do that thanks to the close partnership with Champaign Urbana Public Health District and all the stakeholders and leaders of the community. And the second thing is that we were fortunate to have an amazing group of people on campus who had the expertise, the talent, and the commitment to make sure that the game plan that was very well defined in the spring semester was organized, understood, and implemented in a way that we would be able to succeed. I think these are the things that went well. And another thing that went very well is that as the community came together, we realized that it will take all of us to do our part to make sure that in addition to the comprehensive testing and the comprehensive assessment of different options we should be implementing to manage any potential spikes in COVID-19 cases, we also had to do the things that we know always work and everyone should be doing: wearing our masks, social distancing, and most important, and I want to emphasize this, being responsible not only for our well-being, but the well-being of others.
That's great. Thank you very much. And Marty, Becky, and Nigel, you have been so involved throughout this whole thing and have been amazing leaders. Thank you for that. Can you talk a little bit about the changes that you made as you analyzed data and saw what was happening throughout the semester, and talk a little bit about why you made changes and how they worked? And maybe Marty, you could start us off.
Sure. Thanks, Robin. So from the beginning, we learned every step of the way. And our goal was, of course, to continue to listen and learn from the data and the feedback that we were getting along the way and make pivots and adjustments. And we've made many. I'll highlight three. We very quickly, as you know, we started with everyone twice per week. And then the data told us that we could prioritize our testing in a way that could be even more effective. So very quickly into the semester, once we had data telling us that the overwhelming majority of our cases were with our undergraduates, as you remember, we prioritized. Some of those undergraduates started testing 3 times per week based on their risk that we were able to assess from the data. And faculty and staff and graduate students went to once per week. And we kept that very dynamic. So throughout the entire semester, we have just continually been looking at the data, making changes, always trying to make sure we maximize the mitigation potential of the overall platform. So I think that's probably number one. The second, we learned quickly that we could do a better job of helping people get safely isolated quickly. And so we launched Shield Team 30, which has just had a tremendous positive impact. You know, it's that overall time frame from when you get tested to when you get safely isolated that has the really critical mitigation impact that we're aiming for. So that, I think, was a really big positive step. And then the third, we learned and listened and understood that we could continue to do a great job and better job of partnering with our students to find ways to socialize safely and to empower them and encourage them to socialize safely. And Vice Chancellor Young, I think, and her team just did an amazing job of helping lead in that direction. And we're very excited moving forward to do more and more of that. We're all in this together. And I think partnering with our students to really understand how to socialize safely and make this very sustainable for the long term is going to be critical.
That's great. Danita, would you want to talk for just a minute about some of the things that have happened? I don't know that people know all the events you've had for students and the activities.
Absolutely. Thank you. Yes, we have had tremendous partnerships with our students, our faculty, our staff, who have really come together to provide social gathering in a very safe way, particularly our partners in DIA, who allowed us to have concerts and movies in the Memorial Stadium. That was a really big hit for our students on Friday night and Saturday night, a free, safe way to get together, and all of our partners who, gave away free food. But definitely listening to our students and wanting to have smaller opportunities for them to engage, working with our student groups like our Illini Union Board and our cultural groups and other registered student organizations who came together to provide safe engagement opportunities for our students. And they utilized the app too. They made sure that students had access granted before they did come into those activities. So we've had tremendous success, and we will continue that success safely through the end of the semester.
Great, thank you. And Becky, getting back to some of the things that we learned, from your perspective, what were some of those?
Well, I was actually going to talk about why we made changes, because a lot of people have asked, why are we making changes? Didn't we have a good plan to begin with? And we had a great plan to begin with, but the main reason we make changes is because we listen. You heard that from Marty and from Danita. We are listening to the data first. There are multiple teams of people analyzing the data on a daily basis. As soon as it comes down, multiple teams will look through the data, look for patterns, look for new concerns. We're always watching to see if we can find something new that we can do to improve our control. We're also listening to people. We're listening to experts, the experts in the Champaign-Urbana Public Health District and in other public health districts. We listen to our colleagues in other universities to hear what they're doing and what's working for them. And we listen to our faculty and our staff and our students, and we've had some really great ideas coming from them. So we are really wanting to take in information from anywhere we can to just make this a better experience and to improve our control.
Great. And Nigel, anything to add about what worked and how?
Sure, I'll be happy to. In particular, let me just explain how we know these things worked. So what our goal was to be able to keep the university open and to enable an educational and social experience that resembles something like normal for most of our students. And the only way to do that is to prevent COVID-19 spiraling out of control on the campus. And so that's why we undertook a bunch of measures on the fly as we were learning through this process, including the essential activities mandate that happened at the beginning of the semester. And what we know from modeling and what we saw in real life was that it takes about 4 weeks after a big spike in cases for the numbers to go down. We found clearly that SHIELD contains the epidemic, and after 4 weeks from the end of the essential activities, our 7-day positivity was about 0.12%, and we were getting case numbers in single digits, which is a remarkable achievement for a university community of this size.
Especially when you're testing everyone, right? And it's hard to compare and contrast numbers.
That's how we can do it, exactly.
Great. Andres, one thing that we hear a lot is when will we have more classes in person? Can you talk a little bit about what we're doing to keep the in-person instructional faculty safe and students in classes safe?
Most definitely. One of the things that I think is very unique on our campus is the fact that we have routine testing for all our instructors and the students who are on campus. And of course, we enforce that testing. We have our wellness support associates at classroom buildings, and they check compliance of everyone who uses those facilities. That makes a big difference. As you have heard the chancellor say, there is no evidence of COVID-19 transmission from within on our campus, and that happens because exactly of this amazing ecosystem we have put together. As if you look at our classrooms, you will see they are very well organized and laid out in such a way that social distancing is maintained. And of course, everyone who enters the classroom, in addition to being compliant with their testing and their COVID-19 status, they have face coverings, which are mandatory. We are providing ways in which people can keep their spaces sanitized when they enter the classroom. And of course, we make sure that our ventilation systems have been checked and they're up to date in terms of the quality and the frequency at which we ventilate the spaces. We have traffic routes for each classroom to ensure efficient and safe entering and exiting. And I will tell you, one of the things you see as you walk around campus, you see the community that uses the campus by now having this commitment, if you wish. I think they are doing it unconsciously now, by now, following the guidelines we have put in place. I do not know how else to put it, Robin. I think that the classrooms on this campus are one of the safest places in the state of Illinois, if not the nation.
Great. And Andres, physical safety is obviously very important, but emotional well-being is critical too. And we're hearing from some students who say they feel like their remote workload is overwhelming. Are we doing anything to address that?
The remote workload is overwhelming. I mean, we hear it from the students. Danita, our deans have been receiving inquiries about, what else the university can do to help students with, it is physical, it is emotional, it is mental. And I think everyone experienced it. I'm sure everyone that is listening to us has these feelings, or some of these feelings, being part of their daily lives in this COVID-19 time. But I will tell you, as Danita said, as my colleagues are saying, we are trying to be as responsive as possible to that, especially when it comes to the teaching and the course load that the students have to deal with on top of this mental and emotional fatigue. We ask the faculty to be flexible, to be compassionate, to make sure that the students have the ability to have free time as they go about their daily lives. One other thing I would like to say, the same thing applies to our faculty. Our faculty, the things they have to do in order to continue the teaching online, while at the same time attending all the other things, and some of them attending many of the family responsibilities that were not there before because our community services have been interrupted by COVID-19. They suffer from mental, emotional, and physical fatigue. So we are all in this together. I think being compassionate, understanding the fact that flexibility and understanding make all the difference in the world as we navigate ourselves through this crisis is going to serve us all very well.
Yeah, and good point about the mental health resources from Student Affairs, Andres. Danita, I know your team has done an incredible job of trying to ramp up and go remote and all that sort of thing. Can you kind of walk through some of the things you've done and what you're looking at doing going forward?
Absolutely. Well, we know that this semester has been like no other, in stress surrounding the global pandemic, the academic course load and pressures, and socio-political events have really caused us to feel anxious and uncertain and afraid. And what I really want to stress is that the university does care about your mental health. And we want our students in particular to know that there are many resources. We have staff and faculty as well. There are resources here. And so in addition to the counseling services that are available to serve you, we also have some online and some apps that are available. But when it became apparent that the counseling center would not be able to offer any traditional in-person services, we really made sure that all of our staff clinicians became trained in telehealth. We revised our policies and procedures. We became even more HIPAA compliant by using a video platform, Zoom, that would allow us to have these telehealth services that provided in a safe and a confidential way. We also have launched the WellTrack app, which is designed to help students track their moods and teach them about techniques that will effectively, manage their emotions and situations. But we continuously have our very diverse outreach and prevention services team. They're engaging students in skill building, psychoeducation sessions via an online platform as well. We know that this is a challenging time. We want to make sure that we are responsive to students in particular. We have counseling center psychoeducational series. We still have the Cognito at Risk online interactive program, the Midwise mental health screenings, the Healthiest You that is brought by United Healthcare. So there are a number of ways where students can manage their mental health and their self-care. We continuously look for additional avenues to support our students and their mental health. So we are just now forming a new campus-wide mental health committee, which will be comprised of students, faculty, and our staff, because we know that mental health is a very top public issue, if you will, facing our students in our community. And we're committed to actively addressing this wide range of mental health concerns by, raising awareness about issues that are related to student mental health, any type of policies, and so that we can improve the conditions on campus for students and their mental health conditions.
Thank you, Danita. So important. Andreas, can you talk a little bit about how you're assisting faculty who have to teach both online and in person? I think those of us who thought about this in the spring, just watching it from the outside, if you will, thought about, oh, you're switching to online, but this fall, it's kind of a blend for lots of instructors, isn't it?
That is correct, Robin. It is a blend, and once again, because of the way the community services, schools and so on, have been interrupted by the COVID-19 pandemic and continue to be interrupted, the challenges on the faculty that are teaching online while at the same time attending responsibilities at home are significant. What we have tried to do is we have tried to put together all the resources that are available to us about online teaching and offer the Online Teaching Academy this past summer. There were 3 sessions of that academy. We had several hundreds of our instructors participate in it. And when I say instructors, faculty, specialized faculty, graduate students, everybody had the opportunity to engage and explore ways in which, especially those who have not done it before or who had a difficult time switching to online in the spring semester, could share ideas, expose themselves to opportunities and so on. And I think those things have been very helpful, but we continue to hear concerns by some of the faculty. We continue to hear about the extra effort that goes into sometimes doing that hybrid teaching, because we're trying to accommodate, of course, those students who are not able to be on campus, and those students who, because they're being put into quarantine, they have to continue online. So with all of that, we are reaching out to the instructors, surveying them, trying to understand what other things, other difficulties they're experiencing, so that over the winter break, if you wish, provide them with additional resources and guidance of how, as we go into the spring semester and continue this blended learning with both face-to-face and online, to provide them with more opportunities for them to deal with the challenges of this pandemic.
Great, thank you. And Nigel, I'd like to go back to something that you and Marty and Becky were talking about earlier, how, obviously the whole SHIELD program is an ecosystem, but testing is a really critical component of it. And we know some students have been told they have to test every other day, temporarily every other day. How are those students chosen, and why are you doing that?
Sure, thanks for the question, Robin. So let me start off with why. So testing on its own doesn't prevent the epidemic from spreading, but testing and isolation and quarantine does. And so that's what we're trying to do. So what we're looking for is clusters of infections in real time, and we're monitoring those statistics daily. And when we start to see an outbreak of more than 3 cases in the last 7 days, or a big outbreak just in one day at one particular facility, then we switch to a higher cadence of testing. So the goal is to prevent further transmission in that facility and to protect the people who live there.
That makes very good sense. Thank you. And Awais, we get this question a lot. How many students have we had in quarantine and isolation, and how many have been hospitalized?
Sure. Thank you, Robin. So as you know, we put our data on our dashboard every single day, and about 7,000 cases currently as of this morning in Champaign County. And of those 7,000, I would say approximately 3,000 come from the campus community. Majority of them come from students, 90 to 95% are from the student population. A small portion is from student, faculty, and staff as well. Every single one of them, the goal for us is to put them in isolation within 24 hours of them testing. And we have had very good success. When I talk to my staff and I look at data, about 97 to 98% of those individuals are put in isolation within 24 hours. And then there are a few, who we have difficulty in reaching for whatever reason. But I think that that's a good number as well. Most of them prefer to isolate or quarantine in Champaign itself, although some of them decide to go back home and spend their 10 or 14 days in isolation or quarantine with their families. Again, that is not something that Champaign-Urbana Public Health District encourages, because you are risking spreading the infection to your family if you go back home. So we encourage them to stay in Champaign, and we work with them to provide the resources. About hospitalizations, I do not know of any single case as of this morning in a student who has been hospitalized in Champaign, which is excellent news. Although I do know that there have been cases who have needed, care by a physician, either in the emergency room or convenient care or at McKinley. But those have been mild cases, and they have gone back home and isolated or quarantined at home itself.
Thank you very much. Marty, can I come back to you for just 1 minute? You mentioned the three things that you thought were really critical. T30 was one of them. I don't know that everybody understands what T30 is. Can you just quickly walk through and explain what that is and how that helped us get people to isolation faster? And can you unmute yourself? Thank you.
Sure. Thank you, Robin. Again, the time from when someone kind of submits their sample to the time when those who do test positive have been safely isolated and supported, that's the critical window of time to maximize the mitigation potential for the whole testing program. And so one of the things we learned very quickly is that always looking for opportunities to improve. There was an opportunity to speed up the time frame from which you originally find out a person is positive and then helping them get safely isolated. And so SHIELD Team 30 was launched to specifically address that issue and find a way to help people get isolated within 30 minutes. And remarkably, the team is renaming itself SHIELD Team 15 because it's been very successful. And I think, Danita, you can tell me if this is still correct, but it seems like 15 minutes actually ends up being closer to the time frame when people are being contacted. And there's a huge shout out and thank you to everyone involved in that entire process, as well as everyone who has responded so quickly when you receive those texts and phone calls, because it's made a huge difference. Our modeling shows this was one of the major drivers of increased mitigation efficacy. And thank you everyone for help make that happen.
And it's as simple as letting them know that a human being is reaching out to them and cares about them and explains, you're going to hear from this phone number and you should take that call, because of course none of us take those calls that we think are spam these days, right? If you don't recognize the number. So I think to your point, Marty, just learning little things like that can make a huge difference, can't they?
Yes, I actually want a big shout out to Stephen Bryan, our dean, who has such a sense of how students would best be able to respond to those communications, and really pushing for that. It was such a huge contribution. And again, this is, I think, part of our partnership. We're all in this together, learning how to communicate with one another and looking for the simple things that could actually make a huge difference. And that's a really good example.
Thank you. And Awais, I'd like to come back to you for a minute, talking about the student cases. Has there been much transmission from the campus to the community? I know that was a concern of a lot of people when we talked about bringing people back to campus.
And I know that is a concern for university administration as well as for public health as well. One thing I do want to mention is that for public health, we never ever plan for anything with the campus as a bubble. We know that the campus community, faculty and staff are part of this community at large, and they've been like this for forever. So we never plan for them to be separate. But having said that, I look at data daily, and not just look at data, but I also talk to my lead investigators who are on the phone, talking to individuals, trying to find correlations for any exposure. And I'm really happy to say that I have not yet heard any specific thing that can point to a correlation between campus and spread in the community. There are students who live in the community, who have families, they may get infected and spread to their families, but that is the nature of how things are spreading in every community. But looking specifically from campus to the community, we have not seen any transmission or any correlation that we can say which is happening because of the campus being hybrid and spreading it on to the community at all.
Great. And again, big shout out to you and Julie and everybody at CU Public Health. I know we all know we could not have done what we're doing now without that really, really close partnership with CU Public Health and without the great professionals you guys have on your team. Marty, that's one way that I would say our university community is different from others. Can you talk about some of the ways that you're seeing that we're different and what those advantages are for us?
Sure. And we've talked to many other universities throughout the entire semester, and we've learned a lot. And I think we have reference points now for understanding kind of differences about what we've done here. I think three things stand out. The first is most universities are spot checking when it comes to testing. Okay, they're testing very small subsets of their population, usually just the students and usually just a small percentage of those students, as a way to kind of monitor how they're doing. A key difference is, as everyone knows, we are testing everyone on campus, faculty, students, and staff, fast and frequently. So we see the entire iceberg, if you will, right? We see the whole picture. And the other key is it allows us to go on offense. So with testing, I think the challenge is everybody else, or a lot of other people are playing defense, whereas University of Illinois is uniquely in a position to go on offense and use testing as one of the really important vehicles to help mitigate disease spread. So I think that's been really key. And this is powerfully enabled by the saliva-based test, okay, that Paul Hergenrother and his team developed, that's just had a transformative impact on our ability to actually test on scale, fast and frequent, and to do so in a way that allows that to become a weapon in this really important fight. I think the second is, as mentioned a couple of times, we are very dynamic. So we meet every morning at 8:30 a.m. The entire team gets together from across all the different aspects of SHIELD to talk about updates and understanding where things are, challenges that are being faced, so much feedback that we're all getting from different angles. We all talk about and try to make changes literally every day. Sometimes we communicate 7 or 8 or 9 or 10 times per day as data rolls in. And I think being flexible and dynamic and being willing to change and pivot and learn and adjust has been a big strength. The last I would just say is we've all heard about the challenges in terms of socialization and the consequences that it can have. We are, in a sense, unfairly in a great position because we have such an amazing community. Our students came into the semester, I think so many of them, ready to do their part and excited. You know, this I've got you covered and the messaging around this, we're all in this together. You know, as a land-grant institution passionately committed to serving public good, we had a fantastic starting point. But I will say the ability with which we've been able to partner with our students as teammates on this challenge, and we're all in this to solve the problem together, that's been unique and special. And I think moving forward, that is our critical strength. So we're going to continue to find better and better ways to partner. And therefore, as this is going to be a long haul, we're going to make it because we're going to continue to work together on this.
Great, thank you. And Awais, we know the region that we're in, Region 6, has gone into mitigation. Should we be concerned about that?
Absolutely be concerned about that. We know that this region 6 has almost 20 counties, and they all surround us. People visit from outside, they come into our community. We have people who are visiting outside as well. We know that we are seeing just in Champaign more than 100 cases on a daily basis in the last 10-15 days. And I think that is very concerning for us as well. So we do need to be concerned. What we are finding in the discussion that I'm having with my staff is majority of the people are following the guidelines that are being put forth by the governor for mitigation, which is stay within your groups, stay, gatherings of 25 or less. But what we are seeing is cases are coming up when small groups, even family, households, friends are getting together for dinners or for small gatherings and indoors. And I think that's where we are seeing the most number of cases. So I do believe that people are doing the right thing. They're doing what they're being told, but I think they are also not understanding the consequences of even small gatherings indoors where you're not paying attention to social distancing and masking, and this can lead to cases spreading very, very quickly. And once you have a case in a small group, there is a high chance that everybody in that group will get infected and turn positive as well. So it is very concerning to us. It's also concerning that if the trend stays the same, there will be more mitigation efforts put into the region, which may be forthcoming in the next week or in the next couple of weeks, which again may spoil plans for a lot of people planning for Thanksgiving and Christmas.
Yeah, we just need to be really vigilant, don't we? Thank you. Nigel, what does what Awais just said mean for the university?
Well, first thing, I agree with him that we should be concerned, but we should also, in a sense, be relieved, because the increased mitigation that the governor is putting on is exactly the right thing to do. It'll reduce the pain and will ultimately bring us back into a safe place. So we should be concerned, but more importantly, we should be absolutely compliant. And we know from our data that the rise in the community is very correlated with the rise in our staff and faculty cases. And so it's a good thing that steps are being taken to reduce those transmissions. So what we can do about it is be really compliant. One thing that we also know from the data is that traveling out of Champaign-Urbana area is a source of infections into the community. And so we have to really be mindful of those restrictions and recommendations. This is a dangerous time for the state and the region, but on the other hand, our region and our town is doing better than most, and I'm sure Shield has been a part of that.
Thank you. And Robert, I know Awais said earlier, that CU Public Health never looked at it as us being in a bubble, even though we like to think that we're creating one. But we really are part of the community, obviously, and we want to be. Wouldn't it be better if we could just extend what we're doing on campus to the whole community? And what's stopping us from that?
Well, absolutely, Robin, it would be better. And I'd like to also add, I think we are in kind of a quasi bubble. And that bubble was created primarily because of the deep relationship that we have developed with the Waves and the mayors of Urbana-Champaign, and the outstanding work that these two individuals have done to partner with us to keep the entire community safe. Yes, absolutely. We're not an island unto ourselves. We recognize that very early, and we very early engaged the mayors, who engaged others in the community, the bar owners, restaurant owners, the people that provide private housing, to come together and really take a proactive approach to this. And I can tell you, one of the things I'm very proud of is the partnership that we developed. Because I can tell you, that's one of the things, whether I'm talking with other universities in the Big Ten or with the 252 universities that make up the APLU. One of the unique features we have is the collective impact strategy we've utilized in this case, in this community, through the deep relationship with our mayors, the county official, public health officials. It is unique among higher education, and we are benefiting from that deep partnership by being able to keep our levels low, mitigate spread from the university to the community, and I might add, vice versa. And that's where your core question comes about the importance of testing the community. This is something we've been discussing for almost since the beginning of the semester. But the key, some of the limitations are, how do we make sure that we have the structural capacity, first of all, to expand that testing to the community? As you know, there have been some days when we ran 17, 18,000 tests through the VDL. And so we needed to make sure we had testing capability for our own community. But some of you may be aware, a few weeks ago, we received the delivery of the first so-called mobile laboratory that was delivered on our campus. So now, once we go through the authentication and the extension of that mobile lab to essentially be an operational component of the vet diagnostic lab, where all of our testing is being done, the testing for Springfield, the testing for other partners in this, we then are in a better position to start to implement on that plan. We've talked to the superintendents of both schools and systems in Champaign County, and we've been really taking proactive steps. So, but we have some details we've got to work out regarding, the data systems, the other structural elements, the financing pieces of this. But we're very excited, and we certainly hope that in the next several weeks, we will be able to start kind of a beta testing program with the community and look forward to being able to span that to other key elements that are absolutely important to keeping this entire community safe. We're not in this alone. And part of what we are excited about doing is extending this amazing capability to others. So we're very excited about that piece.
And big shout out to the Granger College of Engineering on the Mobile Shield Lab.
Absolutely, amazing piece. I had a great pleasure of visiting it yesterday and had a chance to meet the industrial engineer that laid it out. I had a chance to meet with our colleague, Dr. Johnson, who was involved in shaping this. And I can tell you, I was absolutely blown away at how, when you look at it, it's relatively small, but you look at the impact that this is going to have in building out this testing capability. It's state of the art, and it's just really reflective of the innovation that we bring to bear on whatever big challenge we have to face. I was very proud to be here.
Great, thank you. One thing I just want to toss in, and Marty, I'm going to throw it to you, but it seems to me that a real point of pride is that everything we've done has been science-based. Can you talk a little bit about the importance of having a science-based response to this?
Absolutely. We have from the beginning understood that was our greatest strength. And I think key to our success has been allowing science to drive all of our decision-making. I think we've also, and increasingly getting good at interfacing that with understanding this is a human challenge as well. And that while we love science and we are kind of committed to continuing to allow that to drive our decision-making, we also fully understand the multidimensional nature of this really challenging problem. And I think we're getting better and better at interfacing the human element with the very best frontier science to make sure that we end up with that kind of multidimensional approach that was going to be impactful for the long haul. So yes, science first, and right next to that is our really strong focus, I think, on the human nature that's interfacing with this disease.
And you brought some great social scientists in to help us with that too. That's been very exciting. Marty, can you talk a little bit about when the saliva test will have FDA EUA approval? That we get that question a lot.
Sure. This is still very much a work in progress. And I can tell you that progress is being made. So we're actively engaged with the FDA, working very closely on trying to define, hopefully, this kind of last stage of clinical studies that would be necessary to complete that process that was started all the way back in August. I also just want to make sure to reiterate to everyone, we don't need it. So just to clarify, Health and Human Services changed the guidelines in September to explicitly state that we no longer would need EUA to operate our test. It's being conducted as a laboratory developed test approved by our CLIA director in a CLIA certified laboratory. And therefore, indefinitely, the guidelines say we can continue to run our test at the VDL, and including that allows us to extend that testing capability into the community, as Chancellor Jones mentioned, as long as those tests are done at the VDL and or our mobile unit. And there's opportunities for others to be able to try to take the same approach, which is, I think, also really important. Now, the EUA would be helpful because it allows, that capability of others to replicate and to use what we've done. It gets easier if the EUA is in place. And so we continue to work very hard to complete that process, because from the beginning, our goal has been not only to really help our community here, but also, of course, we'd love to continue to be a model for the country and the world about how to solve this really challenging problem. And the more broadly our test can be utilized, the better. So it's an important pursuit, and we're continuing to move down that path.
Thank you. And Becky, in a way, I know this isn't a University of Illinois specific question, but What about when we get a vaccine? What happens then?
Well, it's going to depend on what the vaccine looks like. So as you know, many vaccines are currently in clinical trials, in various phases of clinical trials. The results are not yet in. We don't know what effect that vaccine will have, if any, come through. Hopefully some will come through very soon, but it will depend on how effective they are, on whether they block transmission or whether they just block disease. And it will also depend on how many people choose to take the vaccine. So if we have a highly effective vaccine that blocks transmission and that has a big uptake in the community, it will be a game changer. But until then, we don't know. And whatever the vaccine is, it's going to become another layer in our shield. We'll implement it as it becomes available.
Waste, any additional thoughts?
Sure. So what I can tell you is that we have been in constant communication with the state and the feds about vaccines. We are getting specific instructions on vaccine storage as well as delivery. And we are planning actively. I mean, we are planning as if we will have a vaccine in December. Whether we get it in December or in the spring or summer is not that important, as long as we have those plans and partnerships in place to administer the vaccines as soon as they arrive. And we have been actively talking to the campus community as well as the local hospitals, clinics, and pharmacies, long-term care, nursing homes as well. So what we know in our community is we have very good experience with vaccine administration, with our experiences from H1N1, the MMR booster that we gave on campus a few years back. So we do have very good experience in doing that, and we know how to do it. And again, like Becky said, if the vaccine is effective and if people are comfortable, then we will have the logistics to administer them as soon as possible when it is available.
Great, thank you. And Becky, the question everybody's asking right now, what is your cat's name?
His name is Orville.
Orville, he's very cute. Can you talk a little bit about what you're advising people who want to travel over the holidays with or without their cats?
Yes, we are asking people to be safe with travel. Travel is one of the riskiest activities you can take after social gatherings. So one of the reasons we ask people to be safe around travel is that travel can spread infection. So we know that some of the cases that we're seeing on campus are due to people traveling outside of the community to areas with less control and then bringing infection back to our community. We also worry about students potentially being infected here on campus and taking the infection back to their families. As Awais said earlier, we don't want people to go home for isolation, in part because we want to protect their families. So we consider them our extended family, and we want to protect our entire extended university family. So we're really asking people to be careful about travel, and especially not to travel home for Thanksgiving and then come back to campus right away. The CDC recommends that after any travel that you quarantine for 14 days, and we would like people to stick to that recommendation. So please, if you have to travel, do so safely and stay there. And if you have to come back, when you come back, you need to test and you need to quarantine for 14 days.
And today is November 6th. We've finished the in-person portion of the semester on the 20th, 14 days from now. So for those who are planning to travel home, what would you recommend they do for these next 14 days then?
For those who are planning to travel home for Thanksgiving, now is the time to start self-quarantine. That means stay home, essential activities only, and protect yourself and protect your family, and keep testing. The testing will let us know if you're safe to travel, and it will also help us protect you and protect the rest of the community.
Great. And Nigel, do we know that approach works? Or why do we know that?
Sure. Thanks for the question. So essential activities is a sort of extra layer on shield that was designed to kind of bring down cases faster than they otherwise would do. And the things that we designate as essential activities are designed to minimize the gatherings and the opportunities for transmission. So let me just tell you what happened, because as Marty said, everything we do is based on data. So what we saw happening, we had an essential activities in the first few weeks of September, and what happened was that the cases and the case positivity went down and reached a low of 11 cases on September the 20th. And after the essential activities order was lifted, the cases went up a little bit, but SHIELD kept them down, and eventually by October 17th, about a month later, we were into single digits of cases, and the daily positivity was 0.05, I think. So what's happened since then is that cases in the university, in the region, and the state have started to rise fairly dramatically. And in fact, the governor imposed some mitigation starting October the 22nd. So this rising background plus enhanced socialization due to Halloween, football, mitigation fatigue, and so on, that's led to a rise in cases. So we're concerned about that. So as Becky said, those of you thinking of traveling home, it's really important now to start self-quarantining, to really cool down the number of cases and make sure that you're not going to go back home and infect your family and friends.
Great, thank you. And we're all optimistic that we're going to get to the 20th and everybody's going to be able to focus on their final exams and grading and all of that sort of thing and get through the holidays. And then we come back in the spring. And Andreas, are we going to be able to offer more in-person classes in the spring?
I hope so. I hope so, Robin. I think all our students want that. Their parents are emailing us. They're emailing to me personally, asking to make sure that we offer their students as many in-person experiences as possible. And, you know, given the data we have this semester on the lessons learned, I think we should have the confidence, again, as our conditions allow, to provide the students with more in-person learning opportunities. As you heard again from everyone, our classrooms are very safe. The things we do in the community and the way our community behaves provides us with the ability to keep them as safe as anywhere in the state and the nation. And I want to emphasize the fact that that in-person experience adds a lot to the efforts that we need to be directing toward reducing all the emotional stress and mental stress that our students are experiencing right now. So I'm very hopeful. As you know, Robin, in one of the surveys we had of our students, they are very hopeful for the spring semester. So I look forward to it with a hope and anticipation.
Great, thank you. And we started the hour talking a little bit about what went well this semester and what we learned. I'd like to conclude talking a little bit about how we're going to incorporate those things we learned going forward. So, pardon me, but it's going to be easiest for me if I just go through my screen. So Becky, you are in the top left corner of my screen. Tell me a little bit about what you're thinking we'll be doing differently based on things that we've learned.
So I would say the number one thing that we've learned from an epidemiologic perspective is the importance of testing before classes start. So that's something we've learned from what we saw and from what other universities that have provided testing have done. That's really important that people come back and they be tested 2 times before classes starts, which is why we've asked, and gladly the Senate has agreed to push back the start of the semester by a week to give people time to come to town early and to get tested twice.
That's great, thank you. Danita, how about in student affairs? What are you anticipating will be different?
I think what will be different is that we will try to create more in-person, within the regulations of the state in the city, in-person gatherings that can be done safely, focusing heavily on individuals' mental health and their entire well-being. And that takes the entire community for doing so. But we will continue to ramp up our efforts and work with our off-campus partners as well, particularly our landlords and managers, in working with our students and our families to keep our students safe.
Thank you. And Marty?
So I think those are two really important ones. And as Chancellor Jones mentioned, we are very hopeful that we can start extending our testing capabilities into a broader community because we understand we have an opportunity to help really expand capacity for more of our local community to get back to so many of the things that we're hungry for. And I think the more we can help create that opportunity more broadly, everyone wins. So this is something we're really excited about and looking forward to.
Great. And Nigel?
So I think one thing that we've learned from the data perspective is that every single person makes a big difference. And it's not really well known this, but only a few of the cases, maybe 10%, contribute to about 80% of the transmission. So what that means is that when you come back to campus, as Becky said, we want to test people as they come back, as we did last time. But the most important thing is to self-quarantine until you get the results of your tests, so that you're not inadvertently spreading cases, spreading COVID. And that's in fact what happened last semester. We didn't have enough self-quarantine at the beginning, and so there was transmission before it was brought under control. So I think that's a really critical thing, and the modeling shows that that can be very effective in getting us off to a good start so that we can continue as we're able to do at a very low rate during the rest of the semester.
Great, thank you. And away from the community perspective, what would you say?
I think from the public health perspective, I'll say this, and I've said this before, if University of Illinois could have not stayed open this semester, I cannot believe there was any other campus in this country that would have stayed open. So the campus provided them, the university provided the students, faculty, and staff all the tools that were needed to be, to be in a hybrid approach. But I think the biggest thing was the students did comply. Majority of the students complied. And I think that's the reason why we are still open. If you look at Nigel's predictions, if nobody would have complied, we would have had 25, 30,000 cases by now. But we are only at about 3,000 cases at the end of the semester. So more than 90% of this community, the campus community, has really complied very well. And I think the success of the next semester will also be dependent on the same. If students, faculty, and staff comply, we will be able to successfully continue the next semester, maybe open up even more. But I think that that's going to be the key.
Great, thank you. Andreas?
Well, I think my colleagues have summed it up very nicely, but one of the things I want to emphasize once again, Robin, is how important it is that we expand what we do to the community, because I think everyone recognizes the fact that we are part of a community, and the things the community offers to our people, to our students, our faculty, our staff, from schools to businesses and so on, need to be able to continue to work and remain healthy for everyone, to be able to navigate the rest of the time. We have to patiently work with all together to see ourselves to the other end. And one of the things I learned from everyone here on campus is that we need to have this testing regimen we have put together, the ecosystem that we call SEALD, in place and applicable to other parts of the community. The more we provide our schools with the ability to safely continue having their operations also in person, so the people in the community, including our staff and faculty, to have their young ones be at school safely, and them being less stressed mentally, emotionally, and physically to go about their works, the better off the community is going to be. I am very proud to say we are indeed an exemplar community. I think we can provide a testbed for the kinds of things that not only the state of Illinois, but the nation should be doing as we try to see ourselves through this pandemic. The next few months are going to be difficult. They are difficult already for many parts of the nation. I think we need to be taking the things we have learned, you hear from all the colleagues here, and turn them into action for others, opportunities for others to follow as well.
Wow, well said. And Chancellor Jones, as always, we conclude with you. Would you like to add something there or just offer any final remarks before we close today?
Well, let me just say I agree with everything my colleagues have said, and there have been some very valuable lessons that have been learned. And for me, one of the valuable lessons is the importance of transparency, the importance of communication, the importance of engaging as often as you can face to face with our students, our governance structure, and our faculty and our staff. And so I've learned the value of me taking my afternoon strolls on the quad and stopping to say hello to our students and making sure that they're doing well and to thank them for the sacrifice that they're making. I've learned firsthand the value of just saying hello to people as I move about Urbana-Champaign and using eye contact as a way of communicating. We're in this together. We care about you. And I can tell you, these briefings is another lesson learned, that we may not always have the answers, but we are truly transparent. And we will continue to come to you as often as we can, particularly when it's a critical moment where we think providing the insights and the questions that you're posing, answers to your questions are critically important. We may not always have the answer, but I can tell you we take every question very, very seriously. And with that, Robin, I just want to close by saying thank you, thank you, thank you. We're very, very proud to be part of this vital community and very excited what we have been able to do together and what we'll continue to do for the spring semester as well. Thank you so much.
Thank you, sir. That was lovely. So again, thank you to Chancellor Robert Jones, to Provost Andres Cangelares, to Professor Marty Burke, Professor Nigel Goldenfeld, Professor Becky Smith, to Dr. Awais Vade, and thank you to Drew McGregor, who keeps us rolling on these things from Tech Services, and to my public affairs colleagues, Allison Vance, Chris Harris, and August Chess. This briefing, as always, will be recorded and posted to the covid19.illinois.edu website. It will be closed captioned and it will be marked. So if there's a specific question you want to go straight to, you'll be able to go directly to that and not have to re-listen to the entire hour, although it would be a lovely hour to re-listen to, in my opinion. So everybody have a wonderful day and we will see you next time. Please be safe. Have a good holiday. If you're going to travel, please, please, please put yourself on lockdown for a couple of weeks. Thank you so much.